It's a common condition that affects children, teenagers, and adults, ADD and ADHD. But there's a technique that can positively influence inattention and hyperactivity. Welcome, Dr. Myra Preston with Siber Imaging. Dr. Preston, thanks for being here.
Thank you.
We're talking about neurotherapy. Can you explain what it is and how it works?
Yes, neurotherapy is a technique and a therapeutic intervention which addresses the specific abnormalities we know to be in the brains of those with ADD and ADHD and allows us to develop a therapeutic process which will correct those abnormalities.
Why is this so effective with ADD and ADHD?
It is quite effective because it addresses the cause of the attention deficit disorder through the central nervous system, as opposed to treating the behaviors or simply the symptoms.
Which is typically how it's treated, if you will, right?
Yes.
Okay.
Yes.
What else do you do in addition to the neurotherapy? Do you combine it with other treatments?
Yes, we do. And in fact, the American Pediatric Association just released a statement that the level 1 best support for ADD, ADHD is a combination of neurotherapy, parent management training, behavior modification, and minimal medication.
So it's a combination of everything, and as you mentioned, minimal medication.
Yes.
What is the success rate with people who have tried this?
When the child or adult is appropriately identified as a good candidate with a proper diagnosis, the success rate is 70 to 90%.
What makes someone a good candidate? Is it simply if you have ADD or ADHD, or is it more involved than that?
It is more involved than that. There are abnormalities in the brain function which are sensitive and specific to ADD, which makes that child or adult different from the non-ADD child or adult.
Okay. You mentioned it is quite successful. Can you talk about the results that you're seeing?
The results, besides increased academic performance, improved social skills, happier children, happier adults, can actually be quantitatively measured through IQ testing pre and post, with an increase in IQ from 15 to 20 points. Academically, letter grades go up at least 1 letter.
I would think that must be very rewarding for you to see, for kids who've struggled socially and academically, and how hard that can be on their self-esteem and on the family unit, to then work with them and see this great improvement.
Absolutely, and I've been practicing long enough now that some of the first children I worked with have come back to talk with me about their college careers and what they've chosen, and they've often said that they no longer felt limited once they got to college and what they could choose based on their strengths or weaknesses.
Oh, that's great. About how long does it take before somebody would see improvement? Is it different for everybody?
It is different for everyone, but the protocol is a minimum of 41-hour sessions, and we expect to see subtle changes from the 10th to the 15th session, and then a continuum upward from there.
Dr. Preston, thank you so much. It's fascinating work you're doing. To learn more, visit siberimaging.com. That's S-I-B-E-R, siberimaging.com. You can also call 704-543-0427, 704-543-0427. Dr. Myra Preston, thank you so much.
Thank you.